So today on the Conn Job, we're privileged to have Claudia Telling, who is the daughter of a very good friend of mine from college. We run dance team together at LSU. So I traveled to London on my way to Bath, where I was giving a TEDx talk. And my friend Holly said her daughter was having back pain. Well, my husband and I stayed at their home, and when I got there, I was shocked to see Claudia in such terrible pain and with a foot weakness and having difficulty walking. During my visit, I did look at the MRI, and I saw that she had a truly huge disc extrusion that was completely compressing the nerve to her right foot. So I feel thankful I was able to talk to them and help encourage them to get a surgery consultation, because I looked at the records. She had seen an interventional pain doctor already, like she said she's going to talk to us about, who did exactly what I would have done, the exact same injection, and it didn't work because the severity of her problem. So I feel grateful that the whole arc of the care has happened and she's much better. But I wanted to do this episode today because as our healthcare system in the United States continues to have difficulty, it's getting harder and harder for patients to access care. The costs are going up. There's a lot of talk about socialized medicine. And living in the UK, they do have the NHS, which is National Health Service. That's what we'll be using that abbreviation. And I thought it would be good for people to hear firsthand experience of a patient with NHS. And even though I was there and I talked to them and I was in their home, when we went through some of the details today, I learned a few more things about how navigating the system if the NHS was for Claudia. They're very privileged. They're able to pay cash for her care, and she did get excellent care. It's what I would hope for any of my patients. So I hope you guys enjoy the episode today. Good morning, Claudia. Thank you for joining. And so I know that you've had a back pain problem, and now you're getting to the other side of it. And as I've talked about, you live in the UK, so I'd just like you to please start with how your issue began.
Hi, Anne. Thanks for having me.
Uh-huh.
There's sort of two phases to this. The most recent phase is December. I started feeling a bit of a twinge in my back, and it was manageable. I went to an osteopath, and that has worked for me in the past, because if we backtrack to 8 years ago, I had a slip disc type symptoms. And then I just started exercising regularly, seeing physio once or twice a year. And then for the last 6-8 years, it's been completely manageable. But come to this past December, I thought that, okay, great, I'll see my osteopath as I usually do. But then it just kept getting worse. And every week I sort of was stopped being able to do normal things like exercise. And then around January, I started getting a bit of a hunchback. But it wasn't until mid-January it started getting the pain in my right side. So I had an MRI which showed I had a slip disc, and that was the reason I started getting a twitch leaning to one side. And then as the weeks went on, it got to the point where I could not even walk, and I went back to my parents to live with them, basically bedbound for 2 months. I could get to the bathroom on my own, and I could technically walk to the car, but at about 45-degree angle. And then 2 weeks ago, I had microdiscectomy surgery, and then I had a walk yesterday for 35 minutes, so much better than before that.
Yeah, I'm so glad to hear you're better. So it sounds like the whole arc of your symptoms actually started about 8 years ago.
Yeah.
Right. So how did that start?
That was in university. I was in a dance troupe, but I hadn't danced in years, so I was a bit out of practice, and I was doing a high kick. And then I noticed immediately after something's wrong. And then I went to the NHS. They gave me physio sessions, so I started with them, but that didn't help. And then it sort of was like 2 years of different doctors saying different things. I went to a chiropractor, um, and chiropodist. I know I get weird confused about the phonetics of that. And they thought one foot was longer than the other. One physio thought it was something, and another physio said, no, that's just exacerbating the problem. So it was 2 years of just lots of different opinions, and then I went to one osteopath who does physio as well, and he, in a 30-minute session, managed to, sort out some misalignments, and then that was manageable for 6 years.
Right. So you're in the national health system, which is
Yes.
socialized medicine, because there's a lot of curiosity about that in America.
Mm-hmm.
Because our healthcare system's kind of unstable, and there's a lot of talk about it.
Mm.
So when in December, when the symptoms came back, was there any trigger, or was it just kind of spontaneous that they came back?
Mm. Yeah, that's the key question that I've been asked by lots of professionals, and I can't actually pinpoint it this time. I think I had a bit of a twinge in end of August, because I like dancing, like partying. I like electronic music, so I'm always on my feet. I'm always out and about. So I think it might have just been, I don't know, on my feet for too long, and then it kind of twinged and it fixes itself. But I don't think there was anything specific that did it this time.
So the part that I'm not clear on is, so then when you first went to get care, when you started having the pain, who did you see first?
That was private. That was with private osteopath, because the NHS can be really helpful for certain things, but with chronic pain, it doesn't have the funding because it's not a life-threatening issue. It's not something that can be managed, and there are really long waiting lists to get help with the NHS. So I was going through that process of applying. So went to see my GP, who then sent me for referral to the physio consultant, who then consulted me to get physio, which was in 6 weeks' time after that, for the NHS.
So let's slow down so that I can translate this into our system. So physio for us, we call that physical therapy. PT, that's what we call it. So it sounds like you went to your primary care doctor in the NHS, who referred you to PT. That was the first step.
Yes.
And did you do that? Were you able to access that?
So it was January, I went to the GP, and then it was 2.5 weeks to get the appointment with the consultant. And then from that, 6 weeks to get the physio. And at the same time, it was 6 weeks to get an appointment to get steroid injections. But,
okay, so this is what we don't usually have this part. So what I thought I heard you say is when you were referred to physio, you still had to see a consultant before you got physio? And who was the consultant? I don't quite follow that part.
I was also confused because I thought I was going into a physio session 2 weeks after the GP. It's just someone who looks at your situation, does a quick examination, and then sends your situation to a panel of neurosurgeons, who then analyze on a list of urgency, and sort of then decide who gets to get physio or injections at a quicker rate than other people. So it's a list.
Okay, so that really helped clarify for me. I didn't understand that part. So you saw the consultant, and then you got physio 2 weeks after the consultant because the panel okayed you. Is that how it unfolded?
Because the panel okayed me, it was 6 weeks to get the physio.
Okay, and did you go to physiotherapy then?
In those 6 weeks, that's where my situation deteriorated, and that was when I became bedbound and had to go private physios.
Okay, so let me ask another question, because I know that your foot got weak.
Yeah.
So when did your right foot get weak?
That was what the physio consultant picked up, and that's why I was on the urgent list for that meeting with the neurosurgeons. And even with the urgent list, that was 6 weeks for the appointment.
Okay, so private in your system is just private pay. So
Yes.
then what happened? Please help me understand
Yeah.
what happened next. You went to private physiotherapy. What happened?
Yes. Yeah, I went to private hoping that I could get moving again. I had a few sessions. They did ultrasound on my back and electromagnetic pulses, I think it's called. I did a session a week for 3 weeks. And on the third week, he said, this isn't working. It wasn't helping. So that's when he said, you need to get a steroid injection as soon as possible. So again, had to do that private because the urgency was required because I wasn't improving.
Okay, so at this point, did you try to go back to your GP, or you just went straight to a private steroid injection? That's interventional pain. You know, that's my specialty. So the physio referred you directly to an injection, or did you even engage the GP again?
I did engage the GP, but there's a lot of different heads these things need to go through. So the physio consultant through NHS, who was the one who sent my urgent, who saw the foot weakness, sent my situation to these neurosurgeons. She was the one I was communicating with, hoping she could push it, advance it from her side. But there was no availability before 6 weeks. So the only option was wait 6 weeks on the NHS or go private, which was then the very next day. And
Okay, for the physical therapy you're talking about.
yeah,
So I'm at the decision point where you got the steroid injection. Let's review that decision point.
yeah,
So your private physical therapy thought you needed an interventional pain procedure, an injection on the nerve. Okay, at that point, did you just go straight for that, or did you try to go back to the NHS for it?
I think at that phase, how worried my physio was, that I went very much the next day to get the injection privately. So I think from that, it was sort of a decision between me and my parents to cut to go private, do it very next day because we wanted to. I work remotely. I'm working from
Yeah.
bed at this point. I can't lose my job. Yeah,
Right, you're right. I saw you, so I know how urgent it
yeah.
was. Yeah, so I'm trying to understand how you worked through the system. So it sounds like the physio referred you directly to a private interventional pain doctor that they were associated with. How was the doctor actually selected for the interventional pain procedure?
It was quite off the cuff in the sense of the physio had a few different people that he suggested. So it was actually during the physio session, he was really just seeing who was reasonably affordable that could see me within the next 24 hours. That's the urgency that the physio sent.
So that's interesting to me. I mean, I agree with the level of urgency because I was visiting at your house, so I saw. But so there must be some kind of communication system or way for the physiotherapist to check with interventional pain. Do you know how that's done? Or were they making phone calls? What was happening there?
It was phone calls, yes.
Okay, it was phone
Yeah.
calls. So let's back up from here. So if you would have gone through NHS to try to get a steroid injection, do you know what that pathway would have looked like?
Yes. So it would have been after that physio consultation who sent the list to the neurosurgeons. That's when the neurosurgeons made two decisions to book me in for NHS physio and NHS steroid injection. And they were both 6 weeks from that point. So that was beginning of March when those two appointments were booked in for. And then the idea was the steroid injection, you wait, I think like a month or two. And then I think that's when they would then think about surgery. But that wasn't really something that was discussed with me because it was too early at that stage for the NHS.
Right, okay, so that's interesting because what I think I heard you say is your GP referred you to both physiotherapy and for a steroid injection consultation at the same time.
Yeah.
Is that correct? And it would have taken 6 weeks to start physiotherapy and 6 weeks to get the consult. Is that accurate?
Um, it would have been 6 weeks to get both the physio and the actual injection.
Okay.
Oh, no, sorry. I actually got confused there. You're right, it was a consultation for six
Right.
weeks time
Yeah.
for whether I can get the steroid injection. And that would have been another 3 months after that. So we're looking at
Okay.
summertime
So
to
that's
get the
four,
injection.
so that's 6 weeks plus 3 months to get the
Yeah,
injection.
yeah.
Okay. So wow, that's 4.5 months to get the injection
Mm-hmm.
is what it would have
Yeah,
been. Okay,
yeah,
that really helped me get clarity. I didn't
yeah.
see that before. Okay. So then, and I don't, you may not know this, but if somebody has a steroid injection and then they need a surgery consult in the NHS, do you have any idea how long that takes?
The only thing I know time-wise is based on word of mouth and speaking to other people in situations as me. And I've heard that if you're not urgent, it can take well, I know someone who was on the non-urgent list and it was 2.5 year wait. And then after 2.5 years, it was another 3.5 years. So again,
Wow.
take it with a pinch of salt. This was
Yeah.
a cab driver on the way back from my physio who said this. So,
Yeah.
but that was what their experience was.
So for me, your condition was urgent. You know, this is
Yeah.
my specialty. And
Mm.
when I came to your house to visit, what I saw is that you had a weak foot and
Mm-hmm.
like truly intractable severe pain. And then I saw your films
Mm.
and your nerve was being crushed. Okay, so for me, that is urgent.
Yeah.
Um, so then, how did you find the surgeon? How did that work?
That was friends' recommendations. We have a friend in the UK who's a doctor, almost like a TV celebrity doctor, who just literally a few months ago had that surgery, the discectomy, with this person. So we had my mum asked all of her friends who had any kind of disc problems who their surgeons are, and we sort of decided to go with this person. And they had a very quick, they were the ones who were able to give us the appointment the soonest as well.
Right, that's good because your nerve was being injured like ongoing. So
Mm,
that was great that you got in. So I
yeah,
know about your mom told me about your friend, the friend that had surgery, and she was a doctor, but she didn't tell
yeah,
me she was a celebrity doctor. So that's funny. That's interesting.
yeah.
Okay. So what was your experience like when you went for the surgery
Mm.
consultation?
So I did have my MRIs, so I was able to share those beforehand. There were lots of questionnaires I filled out. So when I got there, they already knew everything they needed to ask. So they gave me three options. They said there's three sort of solutions for this problem. It's the first is try wait. So it's like wait, maybe take pain medication, see if that works. It goes away on its own because I've heard that it can heal, the disc can heal on its own. And they sort of said that option can't happen because you've tried that and it's not worked. Option two is physio and steroid injections. And again, I've exhausted both of those. Physio had to stop because I wasn't able to lay on the table. And then steroid injection, I had it a month prior to that consultation, and there was no, the situation was, the symptoms weren't getting better, they were worsening. So the surgeon wasn't able to directly say you need surgery, but they were just saying these are your three options, and you've kind of exhausted option one and two. So then, it was at the end of the day my decision, and I was ready to go into there. I told my parents I honestly just want them to say have surgery, and they were obviously freaking out, being like it's a very serious thing. But I am very happy. I felt like I was in very good hands, and I think I just at that point just was ready to just have it out because
Yeah.
if it was 8 years ago where this started, I tried to maintain it with exercise. Obviously, this is it's a risk to keep it there.
Right. So let's just re-go through the
Mm,
timeline. So it
yeah,
started in December and you had the surgery
yeah,
in March.
yes,
That's 4 months. But your
yeah,
pain was just intractable and you couldn't even walk for how long
yeah.
before the surgery? Was it 2 months or 3 months?
It was about five weeks that I was in bed for 98% of the time.
Okay. So when and how long had your foot been weak before you had the surgery?
Beginning of January when I had the physio consultation.
So your
Yeah,
your foot had been weak for 2.5 months. Is that
Yeah.
correct?
Yeah.
So that's a long time. So how's your foot doing now since the surgery?
I have been told I've got my follow-up tomorrow, but I haven't been told to do any exercises yet, so I won't be able to know, but I'm walking and I'm straight, like physically.
And you feel
So
better and you're not tripping or anything like that?
not tripping. I'm walking. I think my parents are very hyper aware of my posture still needs to get perfectly straight, but it's yeah, I do seem almost human again, but I do have some moments where I might sit for too long and I feel myself hunch and I have to like consciously
Yeah.
stand up, sit up
Right.
straight.
Okay, good. I'm so pleased because so in our system, if you would have been my patient, because you're so young, you're 28 years old, even though I read your MRI and the disc was very large and it was
Mm,
totally what we call obliterating the nerve, I would have tried at least one injection myself if you would have been willing, just because you're so young and we can have
mm,
unexpected results. But after that, I also would have sent you for surgery. So what they basically did was suck out the disc that was extruded that was pressing on the nerve. And you woke up better. When did you feel better?
all of my pre-existing symptoms disappeared as soon as I woke up.
Wonderful.
Yeah.
That's wonderful. Yeah, I'm so thankful for that. So, I mean, you've had a really great outcome. I'm so
Mm,
grateful. And you were able to negotiate the system outside of NHS, it sounds
mm,
like, effectively,
yeah.
using your mom's contacts and my encouragement.
Yeah.
So I'm happy for you. I'm so happy for you that you're
Mm.
better. So overall, like, this is your first interaction with the medical system, right? Because I mean, you're young and you haven't really been sick.
Mm, yeah, I mean, when I
Yeah,
had 8 years ago, when I went to,
right.
all they said was do physio. That
Sure.
was it. That's all that was needed.
So overall, what do you feel about your experience with the medical system? And, just how was it for you to have this whole thing happen at this young age and have to interact
Mm.
intensively with the medical system?
I will say because you want to use the NHS because it's free, and I was urgent. I was really, really hoping that I'd have a little bit more urgency, but the problem is the NHS is getting partially privatized. They have to deprioritize and defund certain areas, and chronic pain is just one of those key ones that's deprioritized. So you do have to start navigating it privately, and I do have private healthcare through work, but that wasn't covered because they didn't cover underlying back issues. So it was all out of pocket.
Yeah.
There were some things I managed to get, but yeah, it is just it's being able to have the ability to basically understand what private healthcare you have, what it covers, and yeah, I think it would have been. I wish I knew a little bit more about choosing a different private healthcare provider who did cover underlying back issues.
So let me ask this. I mean, is it well known that the NHS doesn't cover chronic pain? Did you know about this before, or did you find out when you started interacting with NHS?
I only found out while interacting and then hearing other people's stories.
Okay, so these kind of policies are not like announced publicly?
No, it's not
Okay,
that they say, "Oh, good luck." It's the the system was in place. I was in the system. They did do the stages they meant to do. It's just the timelines of what the problem are.
right. So for me, the timeline that was available to you is
Yeah,
concerning
yeah.
because the health of your nerve was at stake.
Mhm.
That's how I see it, having
Yeah,
looked at your films and saw you and the whole thing. So that concerns me. So I'm
yeah.
very grateful you were able to, get relief and, save your nerve function to your
Mm.
foot. Yeah. Okay. Well, anything else you'd like to say that we haven't discussed yet?
No, don't think so.
Well, you've been very patient and generous with me today, and it's a lot, and I think you've shown a lot of resilience and perseverance, because you just look totally better than the last time I saw you. So I think I saw you about a month ago.
Yeah.
And I'm relieved because you just look relaxed and so much better, and I'm feeling thankful about it. And I'll be following up and checking on your recovery.
Yeah, one good thing is I'm off all of my painkillers now. So I was on 10 different types and now nothing. So that's great.
That's wonderful. These are all great signs. I feel very encouraged. All right. Well, thank you so much for talking with me today, and I hope you have a beautiful day.